Welcome to Literacy RX podcast hosted by SpeechMED, where we delve into the evolving world of healthcare and explore how language and literacy shape patient outcomes.
Hello, everyone, and thank you so much for joining us on the Literacy RX podcast. We're deep diving into the issues of patient literacy and language. I'm Jessica Shin from SpeechMed, one of your hosts, here with Susan Perry, the CEO of SpeechMed. And today we're joined by a very special guest from Boston, Dr. Chethan Ramprasad.
So, welcome everyone. Today we're tackling colonoscopies with Dr. Ramprasad, who isn't just your average gastroenterologist. He's got the brains and the vision to bring cutting-edge research to life. He's part of the prestigious Harvard medical faculty at Beth Israel and Deaconess in Boston. And after sharpening his skills with a fellowship at the University of Pennsylvania and his residency at NYU, he's now pioneering the use of artificial intelligence in colorectal cancer screening. So when it comes to your health, you're in hands of someone who's not only smart, but totally ahead of the curve. So let's break down some myths, get you prepped, and maybe even share a laugh along the way with this great and totally interesting guest. Thank you, Doctor.
Thank you so much for that intro. That's one of the kindest intros I've ever received. Thank you so much for that. So as Susan, as you mentioned, I am on faculty at Harvard and Beth Israel Deaconess in Boston, and I really love my job because I get to screen for colorectal cancer in vulnerable populations, and now everyone above the age of 45 gets a colonoscopy, and it's great because we're able to screen for one of the cancers that's one of the most screenable and preventable. And so I'm very happy to be here. Thanks for having me.
No problem. And, I really envy you because you are one of the only people who can actually use the poop emoji in a professional setting. So it's a very enviable position that you are in.
Thank you.
And I mean, what an amazing background. I just want to say, one of the reasons, the reason we wanted to bring you on in the podcast is, like you said, Susan and I discuss this all the time, just this daily occurrence of new reports on the rise of cancer cases. So tell us a little bit about, what is a colonoscopy like? Why do people dread that word colonoscopy? And are there any other uses for it besides just cancer screening?
Great question. A colonoscopy is a very safe procedure. And as I explain to all my patients before I do the procedure and as I consent to them, I explain that this is a procedure in which patients are asleep and comfortable. I take a camera with a long tube and I look throughout the colon to see if there's any polyps or anything unusual that could turn into a cancer down the road. Rarely I will find a cancer and be able to take it out and essentially be able to treat the cancer then and there. It is a very safe procedure. There are very few complications. Complications are rare. It's a very safe procedure in which we're able to screen for colorectal cancer. You had asked if there's other indications for a colonoscopy. There are few. And if there are digestive symptoms like constipation or diarrhea, we oftentimes will do a colonoscopy to try to see if we can understand what's happening. We take biopsies. We can look to see if the tissue looks healthy, if there's ulcerations, strictures, erosions, sources of bleeding, if there are some. So really a great procedure that is minimally invasive in the whole spectrum of medical care, that is very safe. And so often my patients tell me, I really want a clean out. I want to really start fresh. I want to have a reset to my whole body. And we ask patients before their procedure to drink a bowel prep to cleanse the whole colon so that when I go in with a camera with a long tube, I'm looking to see if I can find any polyps, anything unusual. And without the colon being fully clean, I cannot see well enough to know if there are polyps or other findings in the colon. So a really great procedure that is very helpful for everybody. And I alluded to this a little bit earlier, but we have colonoscopies recommended for everyone beginning at age 45 to screen for colorectal cancer. If somebody has family history of colon cancer, that is earlier, depending on their family history. And if there are symptoms that are concerning to them or their doctor, they may also have a colonoscopy sooner. But the vast majority of people are getting their colonoscopy at 45 now. It used to be age 50. So that
Okay.
is a shared experience amongst everyone in America. And I imagine beyond America, there will be more colonoscopies in the coming future. Our healthcare system in the United States is able to now accommodate having colonoscopies for everybody at 45, but that is not always seen in other parts of the world.
Right.
So, you alluded to the fact that people have to do a bowel prep before the colonoscopy. So, tell us a little bit about that and, what do these instructions entail for people to do the bowel prep and how well do patients actually follow these instructions?
Absolutely. So before the colonoscopy, each patient has to prep or prepare for the colonoscopy. For a lot of people, they have to start changing their diet about 1 week ahead of the procedure. They have to avoid eating certain foods that we call high residue foods, foods that will make it difficult for me to see everything in the colon that I should be able to see. For example, if there's a piece of broccoli or a piece of celery, a lot of corn or seeds within the last few days before the colonoscopy, a lot of times they will stay in the colon for several days and they will block my vision to see a polyp or to see something that needs to be taken out in the colon. So that whole process starts a week before the procedure. Also, a week before the procedure, there's a lot of medications that patients have to stop at least 5 days, sometimes a week before. There's a rising use of GLP-1 medications, which are used for obesity and diabetes. These are great medications, but they also lead the stomach to not empty very well.
Mm-hmm.
And if the stomach doesn't empty well, that patient is at risk of an aspiration or having a complication during the procedure. And for that reason, patients that are on medicine like that, Ozempic, Trulicity, they have to stop that medicine at least a week before the procedure is taking place. So that's just that 1 week. A day before, and some people it's 2 days before, they have to start drinking the bowel prep, which is a solution that will help to cleanse the colon. It is a laxative medication. It is a formula of medications and other forms that will be drank before the procedure, oftentimes the day before and then the night before, to help clear out everything in the colon. And it is difficult to be able to do this preparation. The procedure itself is very easy because once someone is asleep, you have some of the best sleep that you can. And the procedure, most patients feel like it felt like a couple minutes or even less. But it does take effort, organization, and really understanding what is being asked of you to do the preparation for a colonoscopy. So it is definitely challenging. There are a there's a long list of complications in terms of understanding the instructions for doing a colonoscopy.
When you talk about these instructions, I know patients usually get a couple sheets of paper, right? About instructions, like you said, the low fiber diet and the liquid diet, etc. Everyone's used to that. But a lot of it requires a patient to read these instructions. And so, what are some of the implications? There's little particles in there. Are there any negative implications for the patient when they aren't adequately prepared? And for you yourself as a physician, is there a way that you can assess, how well the patient has prepped? Is there a scoring that you do from your professional side that you can measure whether a patient will be adequately, reviewed in their colonoscopy?
Exactly. If the preparation is not good enough, so the
Mm-hmm.
patient has prepared for the colonoscopy, they drank the fluid that they were supposed to, they stopped eating the day before, and they don't have a good enough preparation by the time they're asleep. And then I take a tube to look in throughout the colon, and it looks like it's not a good enough preparation. There is a higher chance that a polyp or a precancerous or cancerous lesion is missed.
Okay.
The procedure itself may take longer. If the prep is inadequate, there is a higher rate of complications, which this is a very safe procedure, but any sort of risk of a tear or bleeding will increase if the preparation is not good.
Okay.
And really, if we start to do a procedure and we see that the preparation is not good enough, most commonly we actually cancel the procedure altogether.
Mm.
So let me put that into perspective. From the patient's perspective, they have called a family member or friend to take off work on that day of the week to take their friend or family member to the doctor's endoscopy unit. They are waiting there for their family member to have the procedure, and we start the procedure, and the patient has an inadequate prep. We cancel after about a minute, and we have to bring the patient back another day whenever I
Mm.
have an opening in my schedule.
Okay.
And they have to come back in a couple months, or maybe for some patients it's a 9-month wait, or sometimes it doesn't happen for another year. And the patient has to redo everything,
Oh,
and now has to do more prep or understand the instructions in a different way. Essentially, everything has to be done a second time,
Mm-hmm.
which is a tremendous waste to everybody involved. And I feel worse for the patients themselves. They are scared about the procedure. They have convinced themselves, they have been organized, they have done what their primary care doctor told them to do. They've done all the instructions to take care of their health, and they put effort towards that. And now they're being told it just wasn't good enough, and they have to repeat for another time to do all of this. So it is a huge issue. And me talking about it, it sounds like it's a rare thing for this to happen.
Okay.
Unfortunately, it's not rare at all. It happens in 1 out of 4 patients in the United States. It is a difficult barrier to address because it is so complex, as we're talking
Mm-hmm.
about, to understand all that week-long timeline of things to do before your colonoscopy. So it unfortunately happens quite a lot.
And, one of the things that I want to bring up is for colon cancer, we know that there's literature out there that Blacks have a higher risk for colon cancer, men have a higher risk for colon cancer, veterans have a higher risk for colon cancer. And yet the literacy level for all of these groups it varies a lot. So do
Mhm.
you see that also reflected in the type of patients that aren't adequately prepared?
Absolutely. There's a wide array of my patients who may be with inadequate preparation. Hard for me to say that there is just one group where
Okay.
that's the consideration. Certainly, as you mentioned, veteran population, anybody with difficulty with high medical complexity
Mhm.
or low health literacy, patients who cannot see visually to read instructions, somebody who does not speak English, it's very difficult to
Mhm.
understand, and somebody who has dementia or another cognitive deficit. All of these are high risk for having poor prep. Um, Physiologically, people with a history of constipation or some abdominal surgeries, or with higher BMI or excess weight, those are patients who oftentimes don't have a good enough prep either. So
Okay.
it's definitely a combination of instructions, but it's also the physiology of that patient, of their own
Okay.
body. So it's a
Mhm.
combination.
And you were mentioning that you recently had a colonoscopy.
Yes.
So being a patient, what was your experience understanding that there could be some gaps in instructions.
Yeah, absolutely. And so I'm a good example. I have family history of a large polyp in my family. So I am not yet 45. I'm
Okay.
in my 30s. So because a family member of mine had a large polyp on their first colonoscopy, that family history indicated for me to
Mm-hmm.
get my colonoscopy about 10 years earlier than my family member had a
Okay.
large polyp. And I had my colonoscopy just last month, and it was a very comfortable procedure. The preparation I found to be easy to do. The procedure was very well tolerated. I had a great sleep. I felt like the procedure was about a minute or two long. I went to sleep and then I woke up. I had no pain afterwards. I had no
Mm-hmm.
discomfort. And I had a big lunch right after my procedure. I went to Cheesecake Factory. So
Okay.
I had a great experience. Let me talk about how the preparation was. For the vast majority of my medical career, this is what I have worked on: colonoscopies and colonoscopy preparation. For me, for this to be my life's work, when I started to do the colonoscopy preparation, I had to remind myself of each of the steps that I had to do. I had a piece of paper that had the diet, the timing, the days, the time of my procedure, where the procedure was located. It sounds very simple. You just go to a place to have a procedure. But in reality, there is so many different moving elements to preparing for a colonoscopy. Just because somebody doesn't follow the instructions well, it does not mean that they are not intelligent or that
Mm-hmm.
they don't care about their own health. It is complex, and everybody is busy in their own way. They have their work, their family, their personal obligations. And it is certainly, from what I could experience in my own right just last month, it is difficult to remember all the steps, especially when you're working and you have other things to do. It is not easy. So anytime that I have patients who don't have an adequate prep, which I just mentioned was 1 out of 4 patients, I totally understand where they're coming from. And I feel bad that that's the way it is. And to put into perspective, I do 2 to 3 procedure days a week, and I do about 10 to 12 procedures a day. So on any given week, I'm doing about 30 or 40 procedures. And it's very common that there is a poor preparation for a procedure.
I think that I've had a lot of colonoscopies and surgery, and I think that a lot of times people, that one of the things is that there's a lot of prep. We're used to, like, the doctor says, oh, don't eat anything the night before, stop eating at midnight or something. And in the case of colonoscopy, we know we have to take medicine. But I think a lot of times that before period of time, like, you don't really plan that for a week, you're going to have to be careful about your diet. And I don't know. I mean, the last instructions that I got for a colonoscopy, literally, they said, oh, well, read the instructions that come with your medicine. We have something online. And I said, what if I don't have, what if I couldn't look at it online? And she said, oh, well, go to the library. They have web access. Okay.
Yeah.
I mean, obviously, I could get that information, but even then, Jess and I've looked at those instructions and they're not real clear about diet. And if you add to that, maybe the fact that, a lot of times they're telling you to eat white potatoes or white bread, something that's easy. And maybe that's not even your familiar food. So,
Right. And I could even give you another example. In my training, and even now, I will have to take call, which means I am on call for patients who have questions about the procedure before the procedure. So Understandably, I get calls at all hours of the night and the day before from patients asking about different questions about the preparation. And it is stated that you should not drink any red or dark liquids.
Mm-hmm.
But a really good question is orange Gatorade a dark liquid?
Mhm.
That's debatable. I understand that question. You should not drink red Gatorade, and maybe yellow Gatorade is better than red Gatorade. But what about orange? It's a question I get a lot. So there is a lot of uncertainty about it. And certainly there are ways to make the procedure instructions much more easy to understand. It is understandably a complex procedure to prepare for, but it is certainly something that we could move on.
I don't know. Is there any procedure that requires more prep than that? I don't even know. I mean, everyday procedure, obviously there are,
Right. It's a good question. In medicine, in the medical field, there are so many procedures that we do. There is the pre-procedure, the procedure time itself, and a post-procedure
Yeah.
time. I
right,
can think of a lot of procedures or surgeries that require
Right.
very intense post-procedure or post-surgery care in terms of wound care, mobility, diet, movement. It is probably one of the most intensive in terms of pre-procedure instructions. I agree with you completely. There is some work to be done for pre-surgery to not eat the night before, to prepare in terms of having supplies ready or having things ready for after the procedure. But it is rare to have a procedure in the medical field where we ask patients
Mm-hmm.
to do a set of homework before they come in. And I should mention, and Jessica, I think you had asked me earlier, is there any sort of quality metric to measure how good the preparation actually is, all said and done?
Yeah.
Number two, is there in real time a way to tell how good the preparation is before I have started my procedure, which are two great questions, and they're actually two separate questions in how I will answer them. First question is there a way to measure how good the preparation is on the colonoscopy? And yes, most widely used is called the Boston Bowel Prep Score, BBPS. The Boston Bowel Prep score is a score out of 9. A perfect score is a 9 out of 9. We break up the colon into 3 segments as we analyze the cleanliness or preparation. A perfect score is a 3, a 3, and a 3 to
Okay.
give you 9.
Mm.
If there is a preparation that is at level 6 to 9, that is adequate enough.
Okay.
Below 6 is not adequate. So if there's any section that has 1 or 0, that's also inadequate. So there are varying levels of what a good preparation is. A 9 or an 8 is technically an excellent type of score. And a fair or adequate type of preparation would be around a 6 or a 7. And kind of a 7 or 8 sometimes is considered a good
Okay.
prep. So there is a variation in how you grade. I do have patients who ask me, what was my score? Was it out of a 9? And they'll know sometimes what an 8 out of 9 or a 9 out of 9. So I do have patients who want that perfect score rate
Okay.
on their colonoscopy, and they will look for that. The second part to your question was about a real-time indicator for how good the preparation is. And just as we're discussing, if there is a real set of instructions that a patient has to do, and this is one of the most intensive procedures to prepare for, and we require that and assume that a patient's able to do all these things before we actually do the procedure, surprisingly, there is not a widely used metric to ask a patient or to assess the patient before the procedure actually starts. So the patient does come into the endoscopy unit. There is a pre-op, we call it, pre-procedure, where the nurses are putting in an IV, they're taking a weight, taking some vital signs like blood pressure before the procedure. Some of our endoscopy units will ask, the nurses will ask if there is a good enough prep. They'll say, how did the prep go? What color does it look like when you flushed the toilet the last time? Did it look see-through and clear, or did it look really dark and could you not see through it? That is a very informal, highly subjective, high error method of assessing prep that is probably the most widely used current system. There is no other system in terms of assessing in real time that is currently used to measure after the patient has done the procedure, but before I actually start my procedure.
And I think there's a lot of miscommunication around that too, because when a patient receives their initial instructions for preparing for colonoscopy, it doesn't explain to the patient what the goal is. It's just change your diet, take this medicine, and come in for the appointment. But the patient has really no idea about, all right, well, I need to clean this to a certain point in order to have a good procedure. And I think that's where one of the gaps really lies in communication for colonoscopies or for the
That is a
prep for the
great point.
colonoscopy.
That is a great point. It's not clear to the patient about what they should expect themselves.
Yeah, I mean, like you said, and we were discussing that there's really not a lot of pre-procedures that require patients to do this much prep ahead of time. So there is that miscommunication, the fact that patients are like, all right, well, I have my appointment date and time, so I will just show up for that and it should be good enough. So to us, we feel like there needs to be more communication for the patient to really understand what are the implications if you don't prep correctly. And that's why you need to follow these instructions, the prep. And I think this is just a little segue where we want to talk a little bit about what SpeechMed is doing. We found, like I said, that there's a huge gap in language of the patient that affects whether they are prepped correctly or prepped adequately for colonoscopy. There's higher risk for some of the underserved populations of getting colon cancer. So we really want to push for that better prep part. And I know the White House has a cancer moonshot program where they want to increase screening, which is all great. But when a patient isn't prepped correctly, then it's all for naught. So we've used our technology to kind of break down those prep steps, makes it easy for patients, get notifications on, all right, today you need to do this at this time, and then they can acknowledge it. So it helps the patient kind of go through each step, and they can also quickly change language. So I can go from English, or let's say my father speaks Korean, and so it makes it easy for him to follow the steps to get prepared for the colonoscopy.
In addition, Jess, I was thinking when the doctor was talking about what a safe, easy procedure it is and how soothing and comforting that is. I mean, I think we should take that and actually, because you know what? I've had 7. I've never had a doctor tell me, they tell you, it's easy, the prep is the work, but in such a soothing voice, it's safe, it's easy, you're going to have a good sleep and it's done. Really, really important because there's an enormous fear factor.
Oh, yes.
Right?
Yeah.
People are afraid.
Oh, yes. And I thank you for acknowledging that. I do try to approach my patients when I meet them for the first time, and I do scope my own patients that I have in my clinic, but I also scope a lot of patients that I have not met before, and I meet them right before the procedure. There is a high level of anxiety, fear before the procedure, and I try to do my very best to make sure that my patients understand that it is safe, well tolerated, with a really good sleep, because they have done all this work. They may have been up all night. They have taken out their entire schedule to do this procedure for their own health. And I like to just make sure they know that this is a safe procedure that is good for their own health. They made a good decision.
Mhm.
And the flip side of that, after the procedure is done, I do recognize to my patients that prep looked very good. I said, you did a great job with the prep. I showed them the photos of their usually totally normal colon, and I may show them the polyps that I took out. But I think it's very important to understand the pre and the post, because it is a part of that patient's journey. I do these procedures all the time, but I fully understand that most of my patients are not exposed to colonoscopies or a GI doctor on a regular basis, but that is absolutely part of my approach.
And really important. And also, we do some videos for people that want to watch them on the app. And I definitely think one that's soothing and comforting is really important, because people are afraid. People don't know what's going to happen. There's a certain amount of embarrassment. And there's just a lot of things, a lot of issues, but it's so important.
Right.
And yeah, and the patient is empowered the more they understand the procedure. And that's, if they are falling asleep, that's the only way for them to feel empowered, is knowing what's going on.
Right.
And so let's take a little break. I know I love the conversation we're going, but I want to do a little teaser, because we're going to go into deep dive into how you are using AI in order to make the colonoscopy prep process more knowledgeable for professionals. So for the audience, please check the description below, and we're going to link it to the second part of our conversation with Dr. Chethan. Thanks.